Good evening, everybody. Meeting after a long gap of nearly about 15 days, 15 to 20 days. In fact, I was eagerly waiting to start the sessions, but it was not possible because my throat was not comfortable. I was not comfortable with it. And that's why little bit late we are going to start. We are discussing regarding the mental diseases, and the concluding part of mental diseases is yet to be finished, and we have kept it as it is because the very important aspect of it, that is the mental regimen, which we have to learn in this session. The last three aphorisms, that is 222, 28, 29, and 230, they are related with this mental regimen. And Hahnemann have tried his level best to explain how one should behave with the patients who are suffering from the mental disease. In fact, you just consider it in 1842, when this sixth edition was ready for publication. At that time, he was thinking about the mental regimen, when the medical world was not even understood the concepts of the psychotherapy. It was not evolved like present psychiatric psychotherapy. And Hahnemann was ready with this psychotherapy with, with the name of a mental regimen. And every aspect he has tried his level best to explain that depending upon what type of patient, what type of mental disease it is there, your behavior should be. And this aspect one has to understand. In fact, this mental regimen which he has tried to explain over there. This regimen is applicable not only for the mental diseases, but it is applicable even to the physical disorders where we can behave with the patient with such a manner. And that's why it is too much necessary to understand the mental regimen, the management of the mental diseases. So we'll go ahead with this aphorism number 228. We'll learn sentence by sentence because every sentence has a meaning. For the students who are exam going, this is the full question, that is the describe the mental regimen as per Dr. Samuel Hahnemann explained in the 6th edition of Organon of Medicine. 20 marks question. So it is useful for exam point of view as well as practical point of view. Let us go ahead with the 228. In mental and emotional diseases resulting from corporeal maladies. That means first variety of mental diseases. We have discussed there are four varieties. In the first variety, it is because of the corporeal diseases disappears and mental diseases develop. The second variety, which is called because of acute exciting cause, which is responsible to produce an explosion of latent fear, producing acute psychiatric disorder. Number three, it is a confusing state between whether it is acute or chronic. So it is early stage of chronic or it might be acute. And fourth variety is exactly opposite to the first, where the mental diseases disappears and corporeal diseases took place. Out of which the first variety, that is the in the mental and emotional diseases resulting from the corporeal maladies, which can only be cured by homeopathic antisoric medicine, conjoined with carefully regulated mode of life. So what he wants to explain, conjoined with. So it is not just giving antisoric remedy. When you are giving antisoric remedy, first important thing is that you have to regulate the mode of life of the patient. And how can you make it? Thereafter, he explains point by point which are the things one should do. So first point that he explains over there, an appropriate psychical behavior towards the patient on the part of those about him and of the physician must be scrupulously observed. See what he says over there. So he explains that your behavior, being a physician, how is your behavior? How is your behavior with the patient? That matters a lot. When such types of patients comes to you, here you have to give time. Here you have to talk with them in a very mild tone. Here you should be very firm but mild. You should not dominate the patient. Patient should feel affectionate with you. That is more important. Your nature should be affectionate so that a patient can listen to you. And that's why your own behavior matters a lot when you are dealing with the first variety of mental disease. In fact, most difficult disorders to treat are the first variety because the paranoid schizophrenia, the depression, the obsessive disorders, all those comes in the first variety. And all those are rather difficult part in our homeopathic treatment. We don't have big institutes where we can treat such types of patients. So if we don't have institutes, then certain mental regimen which you have to follow, out of which first point he explains that the physician's behavior, that is the appropriate physical behavior towards the patient on the part of those about him and of the physician must be scrupulously observed. Second important thing, you have to observe how the other people who are there along with the patient, how they are behaving with the patient. That is one part which you have to explain, you have to observe, and you have to make it appropriate so that patient should feel that he is getting attention. Generally, these first type of disorders are first variety of mental disease where the patients are quite suspicious. If you go with a good attitude towards the patient, they takes it on bad part of it and then behaves in a rather opposite way. This happens many a time, and that's why it is too much necessary to give the time to the patient, to talk with them in a plain manner, to give them attention, to they should feel affectionate towards you. Your talk should be consolable. The person should get happy after regarding. At the same time, such type of behavior should be there on the part of patient from the relatives also or the attendants also. Generally, if the patient who is having psychological disorder like a schizophrenia or a depression, the other members in the family gets affected because of it. And their behavior with the patients gets altered. They start troubling him or they get troubled because of him and they starts avoiding him. And then this fellow becomes more and more dangerous as far as his nature is concerned. Because he feels forsaken. He feels that no one is looking towards him. He feels persecuted. And all those thoughts, negative thoughts, always generates in the patient's mind because already he is in type 1 mental disease. So in such types of mental diseases, the physicians as well as the attendants' behavior plays a very vital role. You don't know what type of patient is there in front of you, whether it is psychological disorder or whether it is physical disorder. And that's why it is so much necessary for you to develop yourself with such type of good behavior so that a patient feel yes, I'm at the right place. So first important thing which he explains, an appropriate physical psychical behavior towards the patient on the part of those about him and of the physician must be scrupulously observed. Scrupulously म्हणजे आस्थेवाईकपणे. तुम्हाला त्या पेशंट बद्दल खरंच आस्था आहे. You have lot of sympathy towards him. That feeling should generate with the patient. That feeling itself is a very important feeling, which with which patient can listen to you. Otherwise, he will not going to listen. And that's why Hahnemann here utilized very perfect word, scrupulously. So scrupulously observe. Number two, so that is number two. Your observation, your behavior with the patient is scrupulous. Number three, by the way of auxiliary mental regimen. So this is what is he called as auxiliary mental regimen. So along with your main medicine, you are giving him a auxiliary line of treatment, and out of which this in modern science it is called as psychotherapy. With homeopathic science, we call it by the mental regime. So giving just a remedy to the patient is not the treatment. In fact, managing a whole case, specifically when you deal with such types of disorders like a paranoid schizophrenia, depression, OCD, all those varieties, anxiety neurosis, all those varieties of psychological disorders, you have to follow this. So auxiliary measures plays very vital role. Then every person comes to you in a different manner. Such people are always enters in your clinic with different manners. If the person is in an angry mood because he was brought to you compulsorily by his parents, he is already in a furious mood. So what he says, third point which he elaborate, to a furious mania, we must oppose calm intrepidity and cool, firm resolution. See, every point here they are explaining. If the patient is in furious mania, furious means तीव्र संताप, प्रचंड रागावलेला, तीव्र संताप, फ्युरी, क्षुब्ध, क्रुद्ध. So if such types of patient enters in your clinic, what is it? You must oppose him with calm intrepidity. Calmness means your behavior should be calm and quiet. And at the same time, intrepidity म्हणजे निर्भयपणा. You should be firm enough. You should not feel frightened because of the patient's behavior. You should be very firm and cool. This is two important quality one has to do. There are many times patient comes to you in furious mood, and when you remain very firm and calm, then they understands what you want to say. So first important thing is that to the furious mania, the physician must approach with calm intrepidity and cool firm resolution. Resolution म्हणजे करारीपण. Resolution. He should be very firm. Whatever he is saying, it is very firm. So it indicates your confidence. Every patient who comes to you always catches your confidence. So your confidence should be very good. Whatever you are telling, whatever you are explaining, it should be very firm. You should not behave according to patients, what patients. Yes, if you want to say yes, you have to behave like that. Then you should be very firm. You have to follow this. Otherwise, it will not going to work. You should be very firm while telling all those things. And if it is so, then patient listens. So third point which he explains, to the furious mania, we must approach calm with calm intrepidity and cool firm resolution. Number 4, to doleful querulous lamentation. Doleful म्हणजे खिन्नपणे. Querulous lamentation. They are always in a what you say lamentation, शोक करत बोलणं, किरकिर करत बोलणं. They are always talking about in such a sense that they are lamenting a lot. Asha patient, there are many types of patients are there in our OPD. So to doleful querulous lamentation, a mute display of commiseration. Mute means you should not talk too much. Display of commiseration in looks. Commiseration म्हणजे दया, करुणा. Your face should be like that, as if you are showing a typical behavior with which patient feels yes, he's a right person with which I have met. So your looks should be commiseration and gestures, both things, gestures and looks, both should be show the commiseration. So another point which he explains, if the patient is doleful, patient is querulous, patient is lamenting, he is talking, he is explaining many number of complaints to you, and he is in a bad mood. Here your behavior matters. How much attention you give, how much you listen to him, whether you really listen to him or not listening him. Everything matters. And you should behave like that as if you are listening to him each and every word. That is very important. Your face, your looks, everything shows the empathy towards the patient. And that makes the difference in such types of patient, and then they listen. Then fifth point, which he explains, To the senseless chattering, there are people who used to talk or chatters a lot, chatter, व्यर्थ बडबड करतात, सेन्सलेस, ज्याला काही त्यांच्या आजार थोडं सांगतात and they go on talking many things which are not at all useful. Senseless chattering, a silence not wholly inattentive. See, a silence, you keep silence, not wholly inattentive. So you should attend, but at the same time not give so much of importance. See, depending upon every variety of a patient, how your behavior should be. That's what Hahnemann is explaining. These are very essential points. So, how your behavior should be, if one is talking and talking which is senseless, not at all useful for you, and he is spending your time, you should not be so attentive to him. Yes, just show him that you are attentive, but you should not listen to him too much. So that is another point which he has explained. So to senseless chattering, a silence not only inattentive. Then sixth point which he explains, to the disgusting and abominable conduct. Disgusting, grunaspad, abominable, one and same here. Disgusting and abominable conduct. And to conversation of similar character, total inattention. So if a patient behaves in a very wrong way, should not be attentive. Total inattention. If you attend him, he behaves much more in the similar manner. He goes on doing same thing, same act again. And that's why you should not attend to him completely when such types of behavior you observe in your team. There are many people, many patients who are psychologically disturbed and they curses and swears in front of you. If it is so, you just be inattentive, never look towards them. Just forget them. Totally inattentive. Understand what he is doing, but should not be attentive towards him. See, every point he is trying to explain depending upon how patient comes. Then seventh point which he explains, we must merely endeavor म्हणजे प्रयत्न करणे. We must merely endeavor to prevent the destruction and injury of the surrounding objects without reproaching the patient for his acts. There might be a chance that patients who are always violent in such types of cases, they try to destruct something. If they have mobile in their hand, they try to break it. If they find something which is made up of a glass on your table, they takes it and throws it away. This can happen. And this might be a possibility. So in such types of cases, what he says, we must merely endeavor to prevent the destruction and injury of the surrounding objects without reproaching the patient for his acts. You should not reproach to the patient. Reproach म्हणजे दुष्ण देणं, नावं ठेवणं. You should not reproach to him. Because if you do that, he will not going to listen. You take it calmly. Explain it him calmly. The word patience on the part of physician makes a lot of difference. That is very important thing. So we must merely endeavor to prevent destruction and injury of surrounding objects without reproaching the patient for his acts, and everything must be arranged in such a way that necessity for any corporeal punishments and tortures, whatever, may be avoided. So corporeal punishments and tortures should not be done. This thing is quite common with the modern science. What do they do? If there is such a psychological disorder patient and such types of violent patient, what do? They tie him to the bed. There are 4 people who are handling him and keeps him tight. There is no freedom. And if you do such type of thing, patient will not going to recover at all because his freedom is lost. It should not be done. Hahnemann says this should not be. If you do such types of treatment, patient never comes out. In fact, he leads towards the destruction of his life. And that he explains in the footnote. He has explained it thoroughly in the footnote. what type of treatment which is there in the madhouses which happens, that he has explained in footnote. But footnote will read later after completing this. This is so much the more easily effected because in the administration of the medicine, the only circumstance in which the employment of coercion means zulum, zabardast. Coercion could be justified. There are many times it has been done in allopathy that they fix that patient tightly holds and compulsorily puts the medicine inside mouth and then person throws it away. They use compulsorily an injection. Anyone says this should not be done. If you do it purposefully, he goes, he thinks they are giving him a poison. That is the thought which develops in their mind. So patient should not feel that he is taking certain thing. He should be free, and then homeopathic medicine plays a vital role. In the homeopathic system, the small doses of appropriate medicine never offend the taste, and the may consequently be given to the patient without his knowledge in his dream, so that all compulsion is unnecessary. So when you are giving the homeopathic remedy to the patient, to such types of patient, and patient is not in a mood to take the medicine, you can give it in his food, you can mix it in his dreams, and taste is not so much altered, and it goes automatically without making a compulsion to the patient. And this is too important. If you try to make compulsion, he feels bad. He goes against you. And this is the common nature of the first type of mental disorder patient, that they always think there are enemies around him. And that is the problem with them. So such your behavior matters a lot and it makes the difference. So this aphorism, he tries to explain how the physician's behavior should be there with the first variety of mental diseases. And that matters a lot. How the physician should be, how he should talk. In, in different varieties of patient, his behavior, how it matters. All those things are there. And that's why different varieties, the furious mania, how he should explain, how he should behave with calm and intrepidity and cool firm resolution, then the doleful, querulous lamentation, just a commiseration, mute commiseration in looks and gesture. The third thing is the senseless chatting, not totally inattentive. And fourth one, where disgusting and abominable conduct is there, you just completely be inattentive. Then you should avoid the surrounding in order to torture the patient. So you should make him free. He should be able to be have enjoy his freedom so that you can talk with him. So first variety of mental diseases, how the physician should behave and how his nature against with the patient should be. That aspect he tried to explain over there. There is a big footnote and there are many difficult words are there in that footnote. So that footnote we'll learn in tomorrow's session. Today we'll conclude with this only, and from tomorrow we'll continue with the regular sessions. Do please be there so that you can learn mental disorders, the concluding but very important aspect and most practical aspect of the from the organ of medicine. So that's all for today. Those who are from Pune or near places, on this Sunday, there will be a big seminar arranged by PHA Pune Homeopathic Association at Pune Hospital between 9:30 to 1:30 in the morning. And I'm going to conduct the practical homeopathic approach towards the rheumatic disorders. It will be a wonderful workshop, in fact, because I'm going to explain exactly the varieties of rheumatic disorders and accordingly how one's approach should be. So it will be a wonderful if you attend that seminar in person. There will be no uploading of the seminar on net. So those who are there take the benefit of it and join with this activity. And thank you for all of you to attending this session. Tomorrow at the 6 p.m. we'll meet again. If there are any queries, we can have. Otherwise, we'll conclude the session. Any query, any question? Okay. We'll conclude the session and we'll meet tomorrow at the same time. Thank you.